won't either. So at some point. So welcome to PNR 204 Exam 1 Review. As I said, I'm doing it a little early because tomorrow I'm heading to Jamaica for a week. So my daughter has surprised me with a vacation, believe it or not. So I'm going to take full
Wow, that's
advantage
good.
of it.
I would too. How long are you gonna be gone?
A whole week,
Wow. Be safe though,
Sunday to
okay?
Sunday. Huh?
Be
Oh,
safe.
yeah. My husband's Jamaican, so he
Yeah.
knows the ins and outs, and we have a bunch of family over there. So we'll be good. We'll be good. And we're staying at a resort, a really nice resort.
Oh,
So
good.
we'll be good. We'll be good. But thank you. All right, let's go to the PowerPoint. There is a PowerPoint and there is like a handout with it that you just fill in the blanks as it goes, but it goes directly with this PowerPoint. It's just a fill in the thing. But there's lots of chapters. It's exams. A one is weeks 1 to 3. Now, this is the hardest exam week for you because you have community and you have PEDS. So it is difficult. So trying to learn which one do I need to know. I mean, they are both, you know, difficult. They both take time. Community isn't that easy thing that you think it is. It's a lot of taking community, is taking med surge, beads, and everything and bringing it out to the community. So you really have to think. So, it is, you're going to have to figure out how to split your times. Now, this PowerPoint has most everything you need. Remember, if you don't get it on this PowerPoint, you don't understand it. As I said, go to your book, look at it, open it up, and it's pretty well goes along with the book also. So
So some of this looks
definitions.
like it kind of goes with community. Some of this kind of looks like
Yes,
it. Okay.
you will absolutely see this program has things intertwined. One does work with the other. Things you study in
Right.
PEDS, you'll be studying in Med Surge at times the same or right after or right before. It's part of the way the program was developed. So
I
yes,
think someone said it complements the other, so it's kind of good
yes,
to watch these. Okay.
absolutely. All right, so let's just go into definitions. If you don't know a definition, you're not going to be able to answer a question. And I'm telling you, a lot of these things you're going to see again. So, cephalocaudal. Well, let's just look at the word. Cephalic is a head, caudal means your feet. So, it's development that goes from the head to the toe. That means, what does an infant do first? They have head control, neck control. And what do they do by the end of infancy at that 1 year? They're attempting to walk or they're walking. That's the toe. So head to toe development is cephalocaudal. Proximal distal is how infants start with understanding their midline, okay? And they might suck their fingers, toes, whatever, and then they start looking around and taking in more. That's proximal distal. That is what that stuff there means, okay? Tamisha, if you can't hear me, the other ones can. Something's wrong with your system, all right? General, specific. Well, first of all, the general thing is you do a grasp. Well, then you do that little pincer grasp. So it becomes very general, open, and then it goes to more specific of that physical. Maturation, total way in which a person grows and develops as dictated by inheritance. That means, how do you grow? What do you look like? How do you develop? How quick? How slow? All of it has to do with where you came from, your inheritance. Growth is just an increase in physical size. Development is that you have an infant where they can't walk, they can't even lift their head. So they lift their head, then they roll over, then they get on their knees and they crawl, and then they get on a couch and creep around, and then they walk. And that is going from a minimal lifting a head. Now it's increasing, doing more and more and more. Then they're walking and they're waddling and falling and running, and then it becomes more and more mature. That's what that means. Heredity is a factor that develops maturation. So the way that you grow and develop has to do from where you, again, your heredity, where does your family come from? Nuclear is the traditional family. You have a mom and dad and they have children. They've not been divorced. They're together and they have children. Extended are those other people that fit into that family, which is grandparents. It could be the grandparents, parents, the children, relatives. Those are all extended. Blended is what I have. Remarried, I have 2 kids. My husband has 3 kids, and now we're blended. So now that's both of us together. An alternative is a communal family. A lot of times you'll see this like in the church, or you'll see this like in some of the cultures, like you have a lot of Hispanic come to Miami where I'm from, and you have them, doing all of your farming and stuff. And they literally make what we call a communal family, and they all help each other. That's what the alternative is. Now, an exclusion reflex is when the first time you take a spoon with food on it and you try to put it on an infant's mouth to eat, and they stick their tongue out. And that's just, they don't know what to do with it yet. They start the up and down thing, but they don't know how not to their tongue. So exclusion is a tongue sticking out. Grasp reflex starts with that. Reflex grasp, palmar grasp, because it's the palm of the hand. And then it goes to the point of pincer grasp, okay? Prehension is that between the fingers and the thumb. It's also called prehension. It's also called a pincer grasp. Very fine, taking a Cheerio off a high chair, eating it. Parachute effect reflex is when you take an infant, turn them over on their abdomen facing down, you put them in a crib or on the floor, their hands and their feet come up. And that happens about 9 months, and they keep that forever because they're protecting their head. So that's what that reflex is called. Negativism, this is your toddler. No, me, mine. And they're very self-centered. So negativism, definitely toddler. Ritualism is a term that toddlers need. Now, toddlers like the same thing all the time, the same foods all the time, the nap time, bath time, all of that ritual, because it gives them comfort and security. They don't like to, get out of their ritual routines. Personality is those unique organization of characteristics that determine an individual's typical or reoccurring patterns of behavior. That means, how do I act? What do I act like when these things happen? It's my personality. Am I laughing? Am I crying? Am I yelling? You have all different personalities. Parallel play is a toddler, and toddlers don't share. So parallel play is they play next to each other, 2 or more, doesn't matter. They're playing next to each other, but they're not playing with each other, and they're not sharing, and they don't want to share. Egocentrism is a type of thinking that doesn't recognize any point of view other than the child's own. And this, again, is toddlers and your younger preschooler ages. Egocentrical. It's all about me, mine, and they can't think about anybody else but their feelings, their thoughts, what they need. So influences on growth and development. So we
Can
know
I,
growth and development. Yes,
can I, real fast, where can I find this PowerPoint to print it out?
it should be in your announcements. If
I-
not,
Yes, it was
Alan,
sent. It was sent yesterday.
Yesterday, and it's in the announcements.
Yes, it has all of the Zoom review links and it has everyone's PowerPoints.
Okay, thank you.
Uh-huh.
it's okay. As long as you get what you need, I'm happy. So growth and development is what kids do. They start with infants, they can't lift their heads, and then they get to the point where they're, adults going off into their world after adolescence. And there's so many changes. What influences it? Well, they're hereditary, their nationality and their race. Where do they come from? Different cultures, different ways are they're being influenced. There are no position within the family, which means, are you the first child, the middle child, or the last child? Makes a big difference. Usually that first one's been, a little bit more pampered or paid attention to. I mean, even me as a mother, I think the first one you look at more. And then the second, the third could be, letting them do what they want more because they've been through it already. And then the other kids watch that child, but that's the ordinal position. Boys versus girls make a difference. And then, of course, the environment. And the environment is, where are you living? Whether are you homeless? Is the environment you live in a happy one, or is there abuse in that environment? Those sort of things feed into environment also. Now, there's different sort of parenting skills. We have the authentic, which is nurturing, affectionate. There's boundaries they set, disciplines there with an open communication. Um, then there's authoritarian, which is that strict, inflexible, my way or the highway, right? Punishment over discipline. The indifferent is where they're really not paying attention, as in detached emotionally. There's no boundaries. They let the kid do whatever they want. Then there's permissive, where they're the friend. They're not a parent. So they're nurturing, affectionate, but there's really no boundaries. There's no, I know what to do. There is no rituals at all with this one. Discipline on your younger kids should be focused on teaching them instead of punishment. And timeouts. Timeouts is 1 minute per year of life. And with that being teaching is, before the timeout starts, you tell them what they did wrong. And then when they're quiet, the timeout starts. And that again is the teaching, just gives them a moment to think about it, and they go on with the day. All right, let's go into a theorist, Freud. Think of Freud, think of anything that has to do with psychosexual, something to do there. So, infants, what are infants all about? Well, infants are all around exploring the world through their mouth, and that's where they get pleasure, and that's where they're self soothing, right? So, oral is your infant. Anal is now that toddler who's ready for potty training. And it's anal because bowel training is before bladder training. Bowels come first. Phallic stage is their understanding there's different parts, boys and girls. Boys like moms and girls like dads. It's just part of what Freud says. Now, latency, I don't really have a jingle lingle or something to tell you latency, how to remember it. Just remember, Freud says that as a school age child, you're spending more time now with same sex peers, girls with girls and boys with boys. And, they're being, those first type of friends. And then, of course, we get to the adolescence, which is all about their genitals and that sexual exploration that's going on, whether they're attracted to opposite sex, same sex, boys and boys, girls and girls, boys and girls, whatever it is. It's all about that hormonal stage going on. All right, here's basically what that just said. Orality, everything in the mouth. We know, pacifier in the mouth, finger in the mouth, a rattle, all the stuff. Anality is all about that, potty training. And remember, toddlers, me, mine, no, 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 and temper tantrums. That is that toddler. Then it goes up to the preschooler, and they're being aware that there's difference of boys and girl parts. And of course, boys like moms and girls like dads. And then Freud's latency is all starting to now the ability to be with people, but same-sex peers is their relations. Now, Piaget, Piaget has several stages, and let's just figure out what they mean. Well, Piaget is about thinking. An infant is born and they just barely know how to breathe, right? And then we put a breast or nipple in their mouth, and now they have to learn how to suck, swallow, and breathe. That's the first thing they learn. Then you take and you put mommy's finger next to that infant, and by a reflex in their palm, they grasp it. So now they've learned how to grasp the finger, or they grasp a rattle that mommy put in there. And then they move their hand and it made a noise. Wow, that's really cool. So they're making noise. So sensory or a motor about the touch, the mouth, and the movement. And then they put it in their mouth, right? Because everything's in the mouth. As they get older, pre-operational, now we're starting to be thinking. They're starting to understand that they have, um, they make sense of stuff. Like I fell down on the steps and the little boy looked at the steps and goes, "Why did you do that to me? Why did you make me fall?" It gave the steps some sort of humanistic behaviors. That's part of it. Or have a broom and it's a horsey you're riding around, or your arms out. It's an airplane you're riding around. Another thing this pre-operational thing does at the beginning of it, you have a child who's around 2, sitting in a high chair, and they want mommy. Well, they found out last week that when they knocked their sippy cup on the floor, mom came running, pick it up to give it back. So you got mommy, right? So I want mommy now. I know, knock that sippy cup on the floor and they're coming back. So this is all about, again, thinking more and more. Now, school age children, concrete. Concrete is hard. I can touch it, feel it, smell it, right? It's something I have seen and heard before. And now I can use it because I have experienced that some way or another. It's not what they thought about, it's what they heard before, or saw before, or tasted before, or whatever it is. That's school age. Now, formal operations, ever hear an adolescent fight their way out of a paper bag to get what they want? Because they can develop new ideas and new things in order to make them their point across or to get what they want. So those are Piaget: thinking, learning, cognition. Now, Erickson, this, as we were saying, Alan was saying, is yeah, it is the most tested of all of the theorists. And Erickson is all about psychosocial, the way that you think about your environment. So, an infant, what does an infant need? When I cry, I want someone to get me because I'm hungry, I'm dirty, or I just want somebody. And when you go and always pick that child up, that child knows I cry, somebody's getting me, and now I trust you. I have trust. I am a happy, well-adjusted child because I know my needs are being met when I need them. Mistrust is when not just once, but most of the time you cry as an infant and nobody comes. In fact, this infant will stop crying after a while because they cry, 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 nobody comes. So why should I keep crying? So trust my needs are met, mistrust, nobody comes, picks me up. I'm not getting what I want. And then I give up. Now, autonomy versus shame and doubt. Automatically mine, autonomy, toddlers, right? So, what does the autonomy mean? I want it, it's mine, I'm going to do. And they're not going to share. And they are all over the place. They're exploring the world. This is what they do, looking under, over, around, and in between, all over the place. So they're into everything. But there's shame and doubt. As parents or as an adult, looking at a child that might want to do something that could hurt themselves, or they're not getting what they need done, so you want to help them, you step in and tell them, no, be careful, don't do that, or come here, let's put it on, you did this backwards, you did this. That is the shame and doubt. With toddlers, we should allow them to do as much as they can without hurting themselves or others. Okay, so autonomy, I do, me do, mine, leave me alone. Shame and doubt, you're trying to hold me back, and I don't want to be. Then it goes into the preschooler initiative versus guilt. That's about me trying to do things for mommy and to help, to get dressed, to maybe make the bed, whatever it is. And the guilt is when you don't do it right, because they want to do it right, and they didn't maybe complete task or something. Now, school age, probably one of the biggest of all the Erickson, the trust and the school age and the adolescent, the ones that are the biggest looked at. But school age is that industry versus inferiority. Again, an industry is a house, it's a factory, it's what you produce, it's what you're good at, it's your product. This is what I'm great at. I play the piano well, I cook well, I draw well, I run well. Well, I feel good about that, and they like to praise from it. The inferiority is, yeah, but I can't kick a ball. I'm not good at spelling. I'm not good at math. And now I feel inferior about it. So, what I do well and what I can't. Industry, my product, my house, my factory. What I can't do, I'm inferior. Then it goes into adolescence, that identity versus confusion. Identity, who am I? What am I going to be? What group of kids do I hang with? All of those things. Am I going to college, et cetera, et cetera? And that confusion is, adolescence is such a difficult time of life. Do I like girls? Do I like boys? Oh, I wanted to be a doctor, but oh, now I want to be a fireman. I mean, it's all of that confusion going in the brain. Now, Maslow. What you need to understand is your basic physiologic needs are on the bottom. Okay, that shelter, that's food, and that is, a home to live in. Now, it goes all the way up to esteem needs. Now, we know that looking at vital signs and looking at an assessment, those are all physical. Esteem needs is giving that child something they do well at so that they can feel good. For instance, my little grandson, I taught him how to swim at age 2. And we put him in swim camp this summer, and we put him there because he was a good swimmer. And he actually is this tiny little 7.5-year-old peanut. He weighs 52 pounds. He's a peanut of a kid, but that kid can do a heck of a backstroke, and he even beats the bigger kids. And putting them into swimming, he excelled, and he feels great about it, and he feels good, and now he wants to learn the butterfly and do that really well. So you put him in things that make him feel good. That's the esteem. But that bottom one's all about those basic things. What do I need? Now, Kohlberg, this is morality, right and wrong. It starts in the infants and the toddler. You don't really know right and wrong yet. They don't get that yet. They're just learning how to, shake a rattle and suck a thumb, right? And to call mommy. Now, when it gets to preschooler, they like to be praised. It's into reward and punishment. So they do try to be more good, but that's the only way they understand what's right and wrong. School-age children are people pleasers. They want to have everybody like them, and they want to be, not in trouble, and they want to please. As it gets older into the adolescence, it's all about what are the right things in society, stopping at a red light or pushing the cross sign to cross the crosswalk for the walk sign, or opening doors, or whatever is society's norms. They've got to figure this out, and adolescents do. Now, infants, for the first 28 days of life, or 4 weeks, they are called a neonate. It's just a term that's used, neonatal ICU. So that's how they got that name, the NICU. Now, after that, up to the year 1, they're called an infant. During the first year, they double their weight 6 months, triple it by 1 year. Born at 7 pounds, at 6 months, they're 14 pounds, and at 1 year, they are 21 pounds. Also, the first 6 months of life, every month they grow 1 inch. This is unbelievable, the amount of growth. That's why we need nutrition, nutrition, nutrition. You don't get nutrition, the gas tank's not full, cognitively, growth development, they will be delayed. Another thing about infants is by 1 year old, 12 months, they should be attempting or taking independent steps by 1 year. Also, teeth. Now, the earliest you usually will see them come in is about 6 months. It doesn't mean that they're coming in at 6 months. They could get 6 teeth at 15 months all at once, but that's usually the first, and that's the rule of thumb. So again, that we're talking about trust.
Sorry,
and
I'm
we're
y'all. I'm sorry.
hold on. Let's see. All right, so again, trust is the infancy as they do start. We know that, right? That's the Erickson thing. We know sensory stimulation and thinking is all about Piaget. And we know that we can teach a lot with like the sensor or a motor, right? That's the touch, the feel, and that is, the texture of it. It's all those things that we look at. Now, there's something called a lethargic infant, and this is a very quiet, they're not as visually, facially active and responding to you. And they're noted to be a lethargic infant. Doesn't mean they're sleeping all the time. It just means that these children don't like bright lights. They don't like to be moved quickly. They don't like loud noises. And when you're speaking with them, you need to speak in a more calm voice for them. That's what that means. Another thing is with these infants, having them sit up, one of those little chairs. They can look around, look at their environment quietly, is what they like to do. During the first year of life, going to the physician's office, they go a lot. They're born. 2 weeks later, they're at the doctor's office, 2 months, 4 months, 6 months. And then if they're sick, and then 12 months. So why do we, not only for the immunizations, what are we looking for also? Well, we're looking for growth and development. Is their height and weight where it should be? Is their growth and development, are they where they should be on there? Are they rolling over by 6 months completely? These are things that we look at as nurses when they come to visit us for visits. And another part of that is, again, teaching. Like if you have an infant that comes in, they're 4 months old, let that parent know that by the time they see him again, this child will be rolling completely over. Make sure that they have them strapped in to where they are, whether it's in a high chair, not necessarily a high chair yet, but like on a changing table, or if they're on the couch, that they're not left there alone. they will roll off. They will roll on the floor. I've seen infants roll off of beds, onto tile floors. I've seen them roll off of changing tables, off of couches, and it's because now they can roll. So teaching that safety. So never leave a kid with any bits of water unattended. They will fall in, go face first on just a little bit, and not to leave them on on elevated surface. They need, especially if the high chair and the changing table, making sure that they're strapped in, but don't leave them on there for too long of a time, only just to get that other shirt or the other onesie or whatever you're doing. For safety and SIDS death, infants should never be alone in a crib or bassinet. And remember, always on their back. This is the new thing. It used to say on the side, but they're also inhaling carbon dioxide, and it also has shown to not decrease the amount of SIDS death if you let them on their side. So only on their backs when they are asleep. Car seat, 2 years old, rear up to 2 years old. They need to be in a car seat, rear facing, in the middle of the car. Okay. After that, they can go front facing after 2. So rear facing for less than 1, below height requirements. Less than 22 also would be the center of the rear seat. And then, of course, make sure that the car seat is secured properly. I know many pediatric facilities do have like car safety months, like on the weekend, and that they have parents come over and to check their car seats, make sure that they're okay. Make sure that the harness is on nice and tight. And of course, take rolled up blankets to snug them in there so that they're really, really good. That sling carrier is a great thing, but remember to have their face so they can breathe, that the material's not covering their mouths. Now, nutrition, as I said, most important thing. The first 6 months of life is breastfed or iron fortified formula. We do not introduce solid food, whether it be cereal, fruits, or vegetables, until 6 months because their GI system cannot digest it. It's not used. It's empty calories and extra energy that they're expending. So that's about, when you're introducing why we don't. Now, at the point where we start giving food, remember, some parents don't want to buy food. They want to make their own, and there's many who do. There are certain things you need to pay attention to. Number 1, no salt. And they say sugar sparingly. No honey. I mean, no honey shouldn't be given till after 1. In fact, some books even say age 2, but no honey because it can cause botulism. All right. We don't know how it was sterilized, processed, how old that stuff is in the container. Did you get it from the side of the road? I can here in Homestead. They're all over the place. But is it, something that I need to be worried about? Also, whole cow's milk can be introduced at age 1, and they want the extra fat. The fat is good for the central nervous system and for growth. So no salt, sugar, very sparingly, cook it till tender, as little as water as possible, because you want the food. You don't want nutrition to be water. Because remember, they don't eat much. You don't want that too much filled just with water that's empty calories, right? You should strain or puree the food and put them in an ice cube tray. And then you can pull out one little cube when you're ready to eat. And that's the point of the ice cube trays. When we start introducing that solid food, we will start with rice cereal. And the reason is it's a very low risk for allergens and allergies. So we always start there. Fruits, vegetables, and meats should be good. They shouldn't be the cheap ones. They need to have the better quality foods. And then as we are introducing foods at 6 months, one food at a time, that means no mixed vegetable stuff, one food at a time, 4 to 7 days in between the introduction of a new food. Fruit juices should not be given until after this time because, again, it's empty calories. They also say when the introduction of food to give the food first and then give them the milk afterwards. They're trying to make the baby eat more food and less milk. And then, of course, fruit juice should be in a cup, not a bottle, because again, I'm worried about the teeth and the cavities. Now, fetal alcohol syndrome is something I've seen a couple of them in my career. And this is that mother who drinks alcohol throughout their pregnancy. And what would you see with this child? Well, they're going to be small growth restrictions. Their intellectual cognition is going to be delayed. You're going to see some physical, facial abnormalities on them. And there'll be all sorts of developmental delays there, complete. And they're saying there is no safe level of alcohol during pregnancy. So one 12-ounce beer or wine cooler, one 5-ounce glass of wine, or 1.5 ounces of 80 proof distilled spirits a day can cause those serious effects to fetal development. And these children are born with alcohol in them and they become irritable because they go through like withdrawals that you would like an adult stopping drinking alcohol. Toddlers ages 1 to 3, the birth weight quadruples by ages 2.5. So from 1 all the way up to 2.5, it only goes up one more. So you triple it and quadruple it 2.5. They start becoming more proficient with their fine and gross motor skills, where they're more mobile, they're less clumsy, they're better with eye-hand coordination, depth perception, all of that. One of the things they're going to start doing is going to the bathroom by themselves. And now they're learning words, how to express themselves. So it's this, newfound thing. So they're going to be talking. When you're potty training, limit the time on the toilet. Don't just leave them there because they think it's a punishment. All right. So minimal the time and let them know that they're not sitting there punished until they do number 1 or number 2, right? So as they become toddlers, you don't have to feed them every 3 to 4 hours like an infant. They can be 3 meals a day with some snacks. Their stomachs can be bigger and they can accommodate those sort of things. As I said, we keep the fat in the diet, like with the whole milk, because it will compromise growth and development if they're on a low-fat diet or giving low-fat milk. It doesn't give the child what they need. And potty bowel training, well, 2.5 to 3 years. It could be before, it could be after. All kids are different. So Erickson refers to the toddler stages as that time of autonomy, automatically me. I'm going to do it. I can take care of it. Let me do it. And the other thing with Erickson, as they're doing those things, realizing that these people who are telling them not to do stuff, it's not a punishment. It's just that they're trying to help. So they start to overcome as they get older that shame and that doubt. Their awareness of the world around them, that comprehension, that cognitive that shows you is that their language is getting better. They're able to express themselves better. You have a discussion question on separation anxiety, protest, despair, and detachment. This is what they go through, especially being admitted into a hospital. Toddlers are the hardest one with separation anxiety, and they need that ritualism, and they need mommy and daddy or whoever need to stay with them at all possible. You know, the negativism, the temper tantrums, all of these things are difficult. But again, you're you're going to put them on time outs for discipline during that. And tantrums, actually, they tell you to walk away. Do not, try to go to and explain that temper tantrum. So walk away unless the child's going to hurt themselves. And then, of course, you have to intervene. Preschooler. Now, this is now working together with other kids. This is now increased attention span. This is they're talking better. They have to listen now. They have to get to the bathroom, right? They can't just sit there. They now have to be, excuse me, I got to go to the bathroom. Raise their hand. All of this is starting during preschool. Gross and fine motor skills, more and more and more developed. They're running and skipping and jumping and hopping and drawing and cutting with scissors and all of these things. Piaget, again, is that thinking. These kids are magical in the way they think, the way that they sit there and they're playing with that broom and now they're a horsey, or taking a doll and they're flying in the air like Spider-Man or Superman. This is all thinking, that symbolic stuff that goes on. Erickson is all about them helping. And we know that they learn that they can't do it all, but it is, I want to be more helpful here. Let me try. And again, Kohlberg preschool, reward development, reward and punishment. And it's all about they're starting to understand about others. This is the first time they start. Infants, toddlers, they don't think about you. It's now that preschooler that ages 3 and higher that says, oh, you got hurt. It's okay. Let me kiss it, make it better. Their language is getting amazing, and they can construct these unbelievable sentences. Know that not all the words are correct. I think transportation was one of those ones that my grandson liked as an early stage, talking about being transported all over the place. But this is what they do. They think of words and they try to talk with them. Play is, everything. They're learning how to play with others. They're learning how to manipulate toys, etc. That cooperative play is now into your preschoolers. And remember, cooperative is 2 or more kids, and that there is a goal. There's an outcome. You're accomplishing something. And of course, imaginative play, absolutely. Their minds are going all over the place. So preschoolers now are not toddlers who don't share. Now they've learned they have to share. It doesn't mean it's easy. So when a kid comes over and wants one of their toys or just grabs it, it might be an impulse, to smack the kid, grab the toy back, but they're learning that they can't, that they shouldn't. It's not right. So some of the concerns about parents is all about like thumb setting, thumb sucking, jealousy, and masturbation. Preschoolers do masturbate. How do you deal with it? If they're in a group, there's people around, take your hands out of your pants, or maybe talking about if you want to touch yourself, go, that's private, go somewhere else. We don't need to see you watch doing it, but not to draw attention that it's a bad thing. It's their body part. They can touch it, okay? It's preschoolers learning how not to be jealous, maybe of new brothers, new sisters, or a new classmate in school. That thumb sucking should stop before their teeth start falling out, so that the new teeth coming in will not be disformed. And another thing that can happen is you getting these children, they're being potty trained. And there's some potty trained and they never wet the bed since. And that is absolutely called the bedwetting who's never been dry is primary. The secondary is that kid who's been dry for a year. Why would a kid all of a sudden in secondary all of a sudden start to wet their bed. Well, if they've always wet their bed, there's nothing abnormal. If they're now, after a period of time, 6 months, 8 months, a year, and now there's something physical. Is it a urinary tract infection? Diabetes insipidus causes you to urinate. Diabetes mellitus causes you to urinate. So we would be looking for why, looking for that medical reason. So here's some things, Piaget and all of those. I'm going to leave them there for you to read. I've really gone over those preschool growth and development. Just know as the kid in Piaget, they are understanding time according to after lunch, mommy's coming for you. The 3-year-olds, they know boys, they know girls. Attention span is about 15 minutes. And then it goes on into Freud is all about boys like moms and girls like dads. It's all about pleasing. It's all about these children trying to do things. And their language is getting more. We know at 3-year-old, they're starting to understand right and wrong, right? And they are extremely imaginative and magical in what their play is. And again, there's really want to please mom. As we get older, we get more and more understanding. They can talk, they can count more. They know songs, their attention span up to 20 minutes, and these are things as they get older, you can see it's going to increase. If they're doing growth and development right, it's going to be increased. Now, school age children. School ages starts at age 6 and goes to age 12. It's 6 years of the stage. So yes, the height and weight for the whole time is a lot of, inches and pounds, but each year, again, is really not that much. They go slow and steady to it. The school age area, they're becoming more independent. They are starting to know what they do well, and they start to, again, they're pleasers. They like to please adults. So school age, Erickson, is all about their stage of industry or their product, their industry, their factory. What do they do well? What are their accomplishments? And that stage of industry they feel good about. We know that inferiority is the stuff they can't do. Freud talks about all about sexual latency, again, same-sex friends. Piaget goes into concrete operations. Again, concrete means there's a building, you see it, you touch it, you feel, you smell it. I mean, it's there. And concrete means you've seen it before, that action, the whatever that kid did, that they can use that again. All right. Adolescents don't need to see it before. School age children need it concrete. They need to have looked at it and touched at it before. School is important because it's that time away from home. It's all about socialization, working with a group. We know that children that are school age, it's same-sex friends, and we know it will change to opposite sex right around adolescence, puberty. Adolescence is that when secondary sex characteristics start. Now, in girls, the first sex characteristic that you see is breast buds. And on boys, it's testicular enlargement. So those are the beginning of puberty. That's what is said. With Erickson, it's all about what is my identity? And identity is many things. Who am I? Who do I like girls? Do I like boys? What do I want to be when I grow up? What group of kids do I want to hang out with? Am I in the drama group? Am I in the art group? Am I in the sports group? Am I in the band group? All of these things. my identity, like, who am I? What do I want to be? And again, a lot more time away from the family. Freud's all about genital stage and, hormones and that exploration with it. Piaget, as I said, is now formal operations. School age is concrete, right? Formal operations, they don't have to see it. They just know that if I do this and this, maybe that can work. And they know, as I always say, they can fight their way out of a paper bag. Physical development during this time is all about puberty and then the secondary sex characteristics. And as Tanner talks about, it talks about the beginning, which is stage 1, and then stage 5 is that when you're completely grown up and have all of the qualities of an adult woman or of a man. As adolescents, it is a difficult time. They're coming in as children and they're growing to be adults. Their bodies are changing. They're becoming more mature. They're having more responsibilities and pressures from the school, from the parents for what am I going to do when I grow up, and making sure you get there, okay? Number one hazard that kills many adolescents. What do you think? Cars? I would say so. Remember, the nursing process is ADPI, right? That we're going to be doing with it, but we're going to assess it. We're going to say, all right, this child has a fever. I'm going to plan, right? Let me see, do I have a prescription here for an antipyretic? Implementation, I'm going to give it. And then the evaluation is, let me take the temperature again. Did it work? And that's as simple as the nursing process is. Now, a Denver 2 is not an intelligent test. All it does, it tells you more evaluation is needed. It looks at the way you react around people, your fine motor skills, how you speak, gross motor, how you're running, walking, talking, all of those things. If the scores are low, you just need more evaluation. It's not anything to do with an IQ, okay? So this just starts it. It doesn't give you an answer. It just makes you say, you got to go look for something else. What's happening? Timeouts, as I said, 1 minute per year of age. It's to know what they're doing wrong and then start the clock. Yes, the BSA is the most accurate method for calculating drug doses, but we know milligram per microgram per unit per kilogram is what we see in the hospital. It's what done of it. Now, sex education, again, adolescents are in that experimental, right? Their identity, looking what's going on. And thing about, teaching adolescents is, number one, letting them talk to you. Many of them know more than you think, and many of them know less than you think. So listening to them and then directing them to the right way. As a school nurse, you might have some brochures or handouts, or maybe there's, a clinic they can go to that, is for adolescents. And of course, we would always teach abstinence, but also we need to be realistic and just have them protected against sexually transmitted diseases. And the leading cause of death among children is accidents, and it's motor vehicle. So medications for children, because of their body systems are more immature, and because we just don't give 2 Tylenol for a child when they have a fever, right? We will do, and the most accurate is the body surface area, the BSA. We use that a lot in your really like chemotherapy type stuff, but normal everyday acetaminophen, ibuprofen, antibiotics, milligrams per kilogram. Now, when you talk about medication and how the body uses it, we know they absorb it, they distribute it, and then they go to the liver, it's metabolized, and then it's excreted through the kidneys. We know because the bodies are immature, those reactions, you can have reactions when you don't think you will because of the children body. Where do you give IM injections to a infant? And it's that vastus lateralis. As they get older, we would put it different. So that would be the IM injection in the deltoid or the ventrogluteal. And the deltoid, there's some medications you wouldn't put there. And I'll give you an example of one. And that would be like a solumedrol. It will burn and it will swell and it will be really painful if you put it in the deltoid. Now, infants and children are smaller. So IV fluid, smaller amounts can cause congestive IV, can cause digestive failure. So if you don't want a congestive failure, one of the things is to make sure your IVs are on an IV pump. You guys are lucky today because when I first started nursing, we didn't have IV pumps. We had that little blue roller clamp. That's all we had. And then we got those little things that you turn that had the number of mLs per hour. Today, every kid in pediatrics, all of them have a pump. Just make sure that it's programmed properly. Any infant who can't eat due to whatever reason, could be due to, they were born and they can't swallow, that child wouldn't be eating because they maybe be choking on it. Remember, they self-soothe through their mouth, so a pacifier should be given to them preoperatively, before surgery, postoperatively when they can't. A pacifier, self-soothing, it really helps. Intake and output, how would you weigh what's coming out of a child? And it's in a diaper. Well, it's really easy. If you have a size 1 diaper and you put it on the scale dry, it weighs 30 grams. Put it on the infant and they do their business, 1 and 2, and you take it off, put it back on the scale. If it weighs 60 grams, that output was 30 grams. 1 gram is 1 ml of output. Airway obstruction, remember, infants, it's the chest thrust and the back blows, okay? And the older one is that abdominal thrust. You will always see some sort of CPR thing there. Now, weight measurements are recorded in kilograms, milligrams per kilogram. So you're going to need to know how to calculate pounds to kilograms. You're going to need to know how to calculate dosages based off of, your dose and what you have on hand, and know that your medications that you're given. One of the medications that we didn't realize way back, because it was one of the only antibiotics back in the 50s and 60s, was tetracycline. And they found that tetracycline caused the teeth to turn gray. So we do not give tetracycline to children under age 8. Any questions? I did do a new exam dosage calculation for exam 1. I have sent it to all of your professors, and I will send it again when I have this recording. So that will be coming out to you also. So you'll have examples of dosage calc, and you'll have this recording in just a little bit. Any questions?
Just